hear that because we're being told on the floor a lot that we don't have enough money to provide adequate staffing for our patients. One of the ways that I see that impact our patients is many days we will have anywhere between 5 and 20% of the total patients in our emergency department are there to receive emergent mental health care services, and they're there sometimes because they couldn't get an appointment in outpatient clinic for mental health care services. Additionally, they end up spending sometimes 24 or 48 hours in the emergency department waiting for an inpatient bed in the community because Kaiser hasn't provided enough inpatient mental health care beds for our members.
I love my job and I don't want to do anything else. But what I am concerned with is after I do my 8-hour shift, sometimes there's no one to replace me. So I'm forced to work another 4 hours or maybe even another 8 hours. The problem with that is, as anyone knows in any industry, when you're first forced to work long hours, there might be that potential to make a mistake. And I want to give the best to my patients 24/7, but I don't want to have to work 24/7 to do that.
In our intensive care unit at Kaiser South San Francisco, we do not have enough nurses to care for our patients. So the $21.7 billion that Kaiser has should go into hiring more nurses to care for our critically ill patients.
In my unit in the NICU in labor and delivery, we sometimes will postpone a patient being brought in for an induction or a C-section. In our NICU, we definitely have some poor staffing issues. What it essentially means that we have a lot of nurses working overtime and really are trying to provide the safe patient care, but what is missing from our element is not only the amount of nurses that I feel like we need, but the proper equipment in the right working order that we need to properly take care of our patients.
In a nutshell, I just feel bad for these patients, especially laboring moms. Imagine if that was your daughter, your granddaughter, your wife, your sister, who's scared if this is the first time they're having a baby and they're expecting that they're going to deliver at Kaiser San Francisco, and then when they call the unit and the unit tells them that we don't have enough nurses to take you, I'd imagine that's a horrible feeling, having to drive all the way to Kaiser Oakland or Santa Rosa or Redwood City or even to a non-Kaiser facility like CPMC.
Right now I'm experiencing on my unit patients not getting their pain medication on time, patients delayed in hitting the call light to be able to be assist and able to walk to even to the bathroom. That puts the patients at risk for falls and it even jeopardizes them in being sicker.
I would spend $21.7 billion in resources, meaning more people to provide excellent care, which is what we need to do for our patients. A lot of them have beautiful TVs and internet, but they sit in soiled beds because there are not enough of us to help them get cleaned up. So this can lead to more sickness and for them to stay in the hospital longer. And I just think it's immoral actually for them to not have the equipment and the resources necessary for them to get well.